One of the biggest issues facing the people of District 12 and Americans on the whole is access to health care and the exorbitant cost of it. Democrats are currently suggesting a Medicare for all or free health care for everyone type plan, but the truth is, plans like this are never free. Estimates show it could cost over $30 trillion, which is huge. Other countries that have these type of plans have tax burdens of over 50%, not just for extremely rich people, but for average hardworking people. That is not the American way, and that system won't work. I would propose a more free market type solution. This would require things like competition of insurance companies across state lines. We would also make sure that all drug prices were properly priced and transparent, and that we would be able to receive them from other markets and other countries to ensure that we're getting the best deal and the lowest possible price. In addition to that, hospitals should be totally transparent in the prices of all their procedures and should charge the same for everyone, no matter if they're using insurance or paying out of hand. This means if you go to Hospital A, they have to announce beforehand that a price for, say, an appendectomy would be $500. That is the case regardless if it's an emergency, if you have to pay for it out of pocket, or if you're using insurance. This would allow hospitals to compete, and regardless if you had insurance or were paying out of pocket, you would be able to go to whichever hospital had the best record for quality service and the lowest price. This would ensure that even the price of insurances went down because people that didn't want to pay hefty insurances would be able to shop around and pay out of pocket for these services that were able to afford them. In addition, something that very few people talk about is that innovation is actually curbed by the way we do our patent policy. Right now, major drug companies are able to patent potential cures or genetic disfigurations that lead to things like cancer. For example, the genetic mutation BRCA1 and 2 actually lead to breast cancer. Let's say that you're a place that's like Johns Hopkins that wants to develop a cure for breast cancer, not because you're trying to make a profit, but because you want to solve a horrible disease. You now have to pay royalties or fees to the company that would patent that genetic disorder in order to be able to begin research to be able to develop a cure for that disease. We need to end things like that and encourage as much innovation as possible. These free market solutions and many others will work much better and be much more affordable than the idea of Medicare for all that's being pushed by the Democratic Party. Let's not forget, what we already see this kind of government medicine in the veterans healthcare, which is an absolute shame. We need to have better healthcare for our veterans right now, and we need to have better healthcare for people overall. Free markets are the way to do that.